Hello dear students. Today I am going to discuss about another very important topic of the ENT syllabus, that is Meniere's disease. Most of the time it comes as a long question in your exams, but many a times a part of this topic can be asked as your short note in the exams, such as management of Meniere's disease or what are the relevant investigations related to this condition. So let's discuss this in detail. Okay, so what is Meniere's disease? Basically, there are few symptoms which has been clubbed together, and if these symptoms are present together in a patient can be a case of Meniere's disease. So it can be defined as disease of inner ear characterized by vertigo, sensory neural hearing loss, tinnitus and oral fullness. Okay, so that is the definition of Meniere's disease. It comprises of four things: vertigo, sensory neural hearing loss, tinnitus and oral fullness. It is also known as endolymphatic hydrops. Okay, now coming to the etiopathogenesis of this condition. So the most common mechanism that is explained for the etiology of Meniere's disease, that is defective absorption by the endolymphatic sac. Okay, so defective absorption of the endolymph by the endolymphatic sac. It can be due to various reasons such as ischemia of endolymphatic sac, that is poor blood supply, or defective absorption of endolymph, or increased production or increased volume of endolymph, which will lead to distension of sac. And if the sac will be distended, the Reissner's membrane, it is a membrane present in the inner ear, so this Reissner's membrane will rupture, and after the rupture of Reissner's membrane there will be mixing of perilymph and endolymph. So whenever the perilymph and endolymph get mixed together, so that will lead to the electrolyte disturbance. Okay, so that will produce the symptoms of vertigo. So this is the most accepted mechanism for etiopathogenesis of Meniere's disease. So what are the other proposed mechanism for the etiology of Meniere's disease? That is vasomotor disturbance, or we can say sympathetic overactivity, that is spasm of internal carotid artery or its branches, that will lead to the disturbance in functionality of neuroepithelium, that will produce symptoms of deafness and dizziness. What can be the other causes? It can be allergy to any food particle or any inhalant particle, that will lead to the increased production of endolymph. There can be sodium and water retention, hypothyroidism, and various kinds of viral and autoimmune causes also contribute to the etiopathogenesis of Meniere's disease. So I have also explained in previous slides that what happens basically in Meniere's disease, there will be distension of endolymphatic system, which can be due to any cause, that is increased production of endolymph or defective absorption of endolymph, that will lead to the bulging of Reissner's membrane. And if the Reissner's membrane gets ruptured, the perilymph and endolymph will get mixed, and it will lead to the symptoms of vertigo and sensory neural hearing loss and many other things. Okay, so what happens is basically it is seen that it is more common in males as compared to females. Okay, the common age group is between 35 years to 65 years or 60 years we can say, and it is mostly seen as a unilateral condition. Okay, now coming to the important clinical features of this condition, very important is patient will experience dizziness, and it will not be a continuous feeling of dizziness. There will be episodic attacks. Also, patient will complain of nausea and vomiting. There is a very characteristic term that is known as Tullio's phenomena. What is Tullio's phenomena? Whenever the loud sound exposure will be there to the patient of Meniere's disease. Okay, so because of the loud sound, the saccule, which is already distended, is lying against the footplate of the stapes. Okay, so the loud sound, or if there is any kind of noise, gets to the ear of patient of Meniere's disease, that will produce vertigo. So basically that is known as Tullio phenomena, that is loud sound or noise induces vertigo. Why? Because it encounters the distended saccule which is lying against the footplate of stapes. So patient will experience fluctuating sensory neural hearing loss also, and there will be intolerance to loud sound. I have already told the reason, and this phenomena, intolerance to loud sound, is also known as recruitment. Patient will feel low pitched roaring type of tinnitus, and patient will also complain of oral fullness. So these are the few important clinical features related to Meniere's disease. So what are the important signs related to Meniere's disease? There will be nystagmus on examination that will be seen during the acute attack. And what are the important relevant investigations that can be done in case of Meniere's disease? We can do a tuning fork test that will show Rene's positive. That means patient will have sensory neural kind of hearing loss. Weber will be lateralized to the better ear. Again, that indicates the sensory neural hearing loss. ABC, that is absolute bone conduction, is reduced in the affected ear. Again, that indicates sensory neural hearing loss. Also in the PTA, we will see a rising curve in early stages and a flat curve in late stages. I will explain it later from the diagram also. And also we can order speech audiometry in such patients, and recruitment will be positive, as I have already explained in the previous slide. What is recruitment, you all know. So these are the few important signs, and what are the investigations that we can order in a patient of Meniere's disease. So here it is a classical audiogram picture of a patient of Meniere's disease. On the y-axis, sound intensity in decibel is plotted, and on the x-axis, sound frequency in hertz is plotted. And here we can see a rising curve in early stages of the disease and a flat curve in the late stages, flat curve or declining curve. Okay, so that is the characteristic of Meniere's disease in audiogram. Okay, what are the few other important, or we can say relevant investigations in case of Meniere's disease? One is CC test. What is CC? It is short increment sensitivity index. The value will be more than 70%. That indicates sensory neural hearing loss or Meniere's disease. Also, another test is threshold tone decay test, or TDT. The value will be less than 25 decibel. In case of electrocochleography, the ratio of summation potential and action potential will be more than 30%. That is, SPAP ratio will be more than 30%. If it is more than 30%, it indicates Meniere's disease. In normal condition, the summation potential action potential ratio will be less than 30%. In case of caloric test, there will be canal paresis, means weakness of response on the caloric test will be there from the affected side or the ear which is having the disease. Okay. And last is the glycerol test. In this, equal amount of glycerol and water solution will be given to the patient orally after particular duration like 1 hour, 1.5 hours. The results of the glycerol test will be interpreted in form of audiograms. Okay, so positive result means improvement of approximately 10 decibel in the hearing or gain of 10% in speech discrimination score. That indicates the positive glycerol test. So these are the few important battery of investigations that we can also order apart from our routine investigation in case of Meniere's disease. Now coming to the treatment part of the Meniere's disease, in acute phase, uh, basically the modality of treatment is conservative. We can reassure the patient. Also, we can give vestibular sedatives such as prochlorperazine, chlorpromazine, and diazepam also. And we can also advise few vasodilators such as histamine or carbogen inhalation. What is carbogen? Basically, it is a combination of 5% carbon dioxide and 95% oxygen. Okay, so that also improves the symptoms of Meniere's disease. So in chronic phase of disease, we advise for the cessation of smoking. Patient has to take a low salt diet, and patient has to avoid excessive tea, coffee, alcohol, and excessive body balance activities. Also, we can advise diuretics such as furosemide, which is a loop diuretic, and vasodilator, beta histine, in dose of 8 mg, 16 mg, or 24 mg. And also we can advise the patient for chemical labyrinthectomy. What is basically chemical labyrinthectomy? It is the intratympanic injection of gentamicin. As we all know, it is a ototoxic drug in the middle ear. So that is chemical labyrinthectomy. Also we can advise to the patient. Now coming to the surgical management of this disease. There are a few important surgical modalities in the treatment of this condition. Most important is decompression of endolymphatic sac. And what are the other surgical methods? That is endolymphatic shunt surgery. We can also do sacculotomy or Cody stack procedure. Cochleosacculotomy we can also perform, and vestibular nerve section. Okay, so these are the few conservative surgeries we can do in case of patient of Meniere's disease. What is a destructive procedure for Meniere's disease? If there is intractable disease that is not getting relieved by all these methods, so we can do a complete labyrinthectomy of the patient. So that is a destructive procedure. We will remove the complete labyrinth from the patient. That will improve the symptoms of Meniere's disease. So these are the few important modalities of surgical management of this condition. There are few devices also which can be inserted via myringotomy. That is a very small surgical procedure. The device name is important, that is Meniere device. So it is basically a intermittent low pressure pulse therapy device. So what it does basically, the intermittent positive pressure waves are produced from this device and it is placed to the round window membrane via a grommet. Okay, so these pressure waves basically reduce the endolymphatic pressure by redistributing it. So whenever the pressure waves goes to the endolymphatic sac, there will be redistribution of the all the endolymph, okay, so in all the areas. So that will cause reduction in the endolymphatic pressure by this device. So the name of device is important, that is Meniere device. Now coming to the last part, that is differential diagnosis of Meniere's disease, there are a few important conditions that we have to differentiate from this, that is vestibular neuronitis and BPPV, that is benign paroxysmal positional vertigo, and acoustic neuroma. So basically in case of BPPV there will not be any kind of hearing loss, and also in case of vestibular neuronitis there will not be any kind of hearing loss. So we can differentiate these conditions easily from the Meniere's disease. So that was all about the Meniere's disease, important points regarding etiopathogenesis, clinical features, relevant signs, investigations, and its treatment modalities, conservative management and surgical management. It is a topic which is covered by me from the exam point of view only. Do not make this video as a ground for any kind of treatment of the patient. Okay, revise it thoroughly and perform well in your exams, and for more such contents follow this channel. Thank you so much.